Were you told that you would fall pregnant as soon as you stopped contraceptives? And are you still getting negative pregnancy tests month after month? Or do you even have an experience with using contraceptives and you never being the same, your periods, your cycles never being the same? Well, in this video, I'm going to tell you why this is and how a homeopathic detox of all types of contraceptives can help you to restore your fertility. Hello lovelies, and welcome to another one of my videos in which we'll be talking about the long-term side effects of birth control and how a simple homeopathic detox protocol that you can apply at home can help you lift those side effects and restore your fertility. But before we get into that, if you're new here, I'm so happy to have you here. Don't forget to subscribe and hit the notification bell if you would like to hear more fertility boosting tips in the future. The first question I get all the time is which birth control types leave these lasting long effects? Is it only injections? Is it only the pill? And the answer is all types of synthetic hormones can leave a lasting imprint on your hormonal system, even years and years and years after you've stopped the pill or stopped the injections. And it is also applicable to things like the local rings, that you can wear in the vagina that give very local hormones. Even those can leave a lasting imprint. And that is why detoxing contraceptives is pretty much the first thing I do after telling people to start charting, is detoxing of contraceptives, pretty much the first or second thing that I do with my patients. But we'll talk a little bit more about that later. Oh, and don't forget the hormonal coil is another one. So we need to understand how birth control works. Our natural hormonal system is not static. It's a dance. There is constantly communication between glands, which hormones to produce when, so that during a cycle you can build a uterine lining in your womb and that you can develop an egg and release it so that when it is fertilized, it can nest nicely in the lining of that womb. When you take synthetic hormones in whichever shape or form, that entire hormonal dance just stops. Because you are flooding your system with synthetic hormones, it will communicate to your body through those high levels of hormones, oh, hang on, you no longer need to produce so much FSH or so much LH. And that is done mostly through progestin in the pill and sometimes in the combination pill also estrogen. As a result, your anterior pituitary gland is told to no longer produce FSH, follicle stimulating hormone, and LH, luteinizing hormone. If you are using ovulation tests, you may recognize the latter one because that is what we test to see if an egg is about to drop. FSH is the one that matures the eggs and LH tells the body, hey, let's drop the egg. There are other ways that synthetic hormones tell your body to not be fertile, but these are basically the main mechanisms. This period is actually also called a withdrawal bleed. Manufacturers were actually able to produce contraceptives that made you never have a flow anymore. However, most women are still attached to their flow because it is a form of femininity. And that's why the pill mostly has been developed in a way that you still bleed every month and feel like you're having a period. So let's talk about the side effects of contraceptives, shall we? You know what? The hormones that we produce to produce an egg or a uterine lining aren't the only ones that we produce. We produce hormones to feel good, to get going in the morning, to calm down in the evening and go to sleep, and to battle stress, inflammations, and just generally feeling sick. So contraceptives are going to affect us way further than just not ovulating. This is, for example, why a lot of women say that they have continuous PMT or PMS, depending on where you live, how you call it, or that they have depression all the time since taking the pill. And this can even last after they have stopped using the pill because their hormone balance has changed permanently. You may have heard of women or have experienced yourself that using contraceptives makes you hold on to weight or that you start to have cellulite suddenly. This is because using the pill interferes with insulin production. And this is one of the reasons that I often see, it's not the only reason, but one of, I often see that women after using contraceptives or while using contraceptives suddenly develop PCOS, seemingly out of nowhere, but it's actually related to the contraceptives. Here's another one. Haven't you heard of so many women or experienced yourself that suddenly your sex drive just drops when you are taking the pill? So maybe you're just not falling pregnant, not because of the pill, but because you kind of don't want to do it anymore. But the real reason that your libido drops is because testosterone also drops when you start taking the pill. And this is actually another reason why the contraceptives that have been developed for men, yep, they exist, they never actually made it to the market, because what guy wants to lose his sex drive, right? Here's another fun one: hair loss during the use of contraceptives. And yes, sometimes the hair loss stops and your hair grows back after taking contraceptives, but depending on how long you were taking them, the follicles may be destroyed forever and the hair never returns to the way it was before. That can be fantastic if you are growing a mustache or you would like your leg hair to thin out, but hey, here we want plenty, don't we? I know a lot of young girls have been prescribed the pill either for very painful periods or for acne, right? And that is because the synthetic hormone, estrogen in this case, suppresses the production of sebum, which is the oil of your skin. So on the pill, your skin may suddenly clear up, but guess what? You stop and it comes back with a vengeance. So not only is it back, it's worse than it was before and you haven't got a solution. Great. So if you have experienced that, don't you worry, this is a common issue and it definitely can be solved in another way. It is also known that contraceptives deplete our bodies of vitamin B and of zinc, and both are super important for the health of your adrenals and stress management. So if you have felt more nervous and more prone to stress than you did before, it could be due to that. So it's important to supplement with vitamin B and with zinc if you're taking contraceptives or you are post-contraceptives. And definitely last but not least, the single thing that I encounter the very most post-contraceptives is that women have estrogen dominant symptoms. And as a result, they often have progesterone deficiency, not necessarily because they don't produce enough progesterone, although that is a possibility, but because they have so much estrogen in their body that they aren't able to produce enough progesterone to balance that out. And as you may know, progesterone deficiency can cause you to have a shorter luteal phase, meaning that there isn't enough time for a fertilized egg to implant, or if it does happen at all, that you may lose the pregnancy early because your body is not able to produce enough progesterone. I recently did a video about boosting progesterone, so I will make sure to link that in the cards up above. Another issue though with estrogen dominance is that you may be ovulating a lot earlier because your estrogen peaks too early, and that communicates to your body that the egg is ready and ready to drop. However, the egg hasn't had enough time to develop properly. So if you ovulate around day 10 or earlier, that means that the egg has had so little time to develop that the chance of you conceiving is very, very small, even if sperm and egg do meet. I also did a video recently about estrogen dominance, and again, I will link that in the cards up above. Now, of course, you are wondering if using contraceptives in the past is still affecting your fertility today, whether you quit last month, last year, or 15 years ago. And my answer is it most likely is. You see, I find that with most of my patients that they have still some sort of hormonal imprint left on their system. Of course, the hormones are no longer actually chemically in your body, but it's as if the message of those contraceptives, of those synthetic hormones, are still there. And the cool thing though is that with homeopathy, you are able to detox that imprint. It is like you can tell your body, hey, remember you were taking all that stuff? Let's go back and let's talk about that. You no longer need to worry about not ovulating, about not producing enough FSH, about not producing enough LH. And detoxing homeopathically these contraceptives just rebalances your anterior pituitary gland. And when that little guy is back in the spot where it should be, it has a knock-on effect on your entire hormonal system. It is not so strange that contraceptives have such a huge impact on our body. Your body has been told to not ovulate. That is super unnatural. So it can be difficult, especially if you've been taking contraceptives for a longer period of time, for the body to pick back up ovulation again. Hey, but when it does happen, how awesome is that? That's not to say that if you are ovulating that you're not suffering at all from that hormonal imprint. And even if you've only taken the contraceptives for a month, you will know if it had lasting effects. For example, have you developed PCOS or PCOS symptoms since taking them? Have you continued to deal with, for example, anxiety or sleep issues? Have you had skin issues, like namely pimples in your face? Or have you seen that your cycles have become a lot shorter, you have a lot heavier periods, maybe more clotting? Or maybe you're seeing that your temperatures aren't as good as they used to be, if you have a reference at all. Well, then these can all still be indications that you are dealing with that hormonal imprint. Although with estrogen dominant symptoms, I often see that women have many days of cervical mucus and high quality, like the egg white cervical mucus, it is also possible that you don't have any at all or very little. Again, these are indications that the hormonal imprint is still there on your system. One more, having had a loss of sex drive and it never having returned even after quitting the contraceptives. Seeing how many women have used contraceptives from such a young age, and it is such an important detox in my practice, I have put together protocols that you can purchase from my website so that you can learn how to detox homeopathically at home. Of course, I will link that in the description below. Hey, and if you're dealing with estrogen dominant symptoms, you may want to check out the tips that I put in the video on your screen right now. And in the meantime, see you in the next video. Bye!